to start. So it's just like a standing hip car. And if you have really good body control, you can do this in the middle of the room. If you don't, then it's really helpful to put some kind of a block behind your back so that you can't move. Like the post works great. Somebody's leg. I'm not sure what your options are, but I'll let you figure that out. So you're going to bring this leg up, kind of try to get this foot up as high as you can, and then you're going to lift, trying to keep your shin perpendicular to the floor. So that's external rotation for the femur when this bone is rolling up. So trying to pull up as high as you can towards your face without bending your spine, and then as high to your shoulder as you can without moving your hips at all, which you can't really because you're on the floor. Don't let this top hip drop back. Pull this as far as it goes. Once it starts to want to push back, that's when you've hit your end point. Then you're going to start to roll into internal rotation, which the leg is going to wind up descending. Try to pick the foot up higher than the knee, and then pull the knee as far back behind your body as you can without arching your back. Should feel a good glute squeeze, hamstring activity here. Lifting it back up again, trying to get the foot up high. And then when you can't really go to the side anymore, that's when you're going to start externally rotating and pulling it up high into this abducted position. And then keep the knee here, pulling the foot forward for external rotation. And then come down. And then go back. Get far into that end point, internally rotating, lifting that foot up. And back down. And again, lifting it up, try to get the foot up as high as it goes. And then rolling through, keep those hips nice and still. Pull the foot forward and down, good. Switch sides. Oh, yeah. All right, bring it on up. Drop this in here. Okay, and lift it up. Pull that knee back as far as it goes, and then pull the foot around. When you start that rotation, try not to let this knee punch forward anymore. You want it to stay where it is, and it can descend, but that way you travel through that back part of that capsule. Pull the foot up, squeeze the knee down, still trying to keep the foot up, and then lead, lifting with the foot. Back up into the shoulder, pull the foot forward, and come down. And back around. And back, pull the foot up. And around again, pulling that knee up and in, and forward, and down. Great. Okay. We're gonna grab